Deacon from the Carthage Christian Church. He's been so involved in so many ways with this issue and others, and he's going to open us up.
Would you join me in a word of prayer? Gracious and loving God, you care so deeply for each and every one of us. May we start to care so deeply for each and every one of us. May we follow your guidance and your grace, the example of your love and mercy that you pour out so freely on each one of us as your children. May we root that essence, the care, compassion, love, justice, and mercy in all that we do to help us to care for one another as you seek to care for us. We ask these prayers and the unspoken ones in our hearts. In your name, amen.
Very briefly, I'm just going to lead us in a little chant. I say hands up, you say healthcare. Hands up! Healthcare. Hands up! Healthcare. I say hands up, you say healthcare. Healthcare. Hands up! Healthcare. Hands up! Healthcare. I say zero, you say cuts. Zero. Cuts. Zero. Cuts. Zero. Cuts. Zero. Cuts. In a city where in some neighborhoods, African American males have a life expectancy of 20 years shorter than white males in other parts of our city, we must stop the repeal of our city health care and support our babies and expecting mothers. This is a public health issue. We must not allow our city to repeal health care for the people of Madisonville. We will not allow the city to repeal health care and place our babies' lives at risk and jeopardy and our women's health at risk. We can't play politics with babies. And this is really about who we see as important. Do we see the people of Madisonville as important? Do we see our babies as important? Then we need to stand for them and with them and demand zero cuts to our health department. Zero cuts. The health department budget is off limits. For our next speaker, we have Cheryl Fulton Leksan. She's from Xavier University, the Associate Director of Nursing.
Hello everyone, I'm honored to be able to speak to you guys this evening. Probably one of the biggest concerns I have about any kind of cuts in public health is, as many of you may know, Cincinnati has one of the most deplorable infant mortality rates, higher than most other cities in this country and higher than a lot of other countries. But in the past 5 years, that infant mortality rate has been reduced by 20%. That's huge, and a lot of that has to do with our public health. The people who need public health are the ones that are typically the sickest and are least likely to afford health care. It is our responsibility to keep our community healthy. And cuts on the infrastructure, streets, roads, bridges, seems much more appropriate than cutting health care to people who can't otherwise afford it. We need to have an investment in people. That is an investment in our future.
Thank you so much, Cheryl. And our next speaker is Billie Mays of United We Stand. Billie Mays.
All right, hello everybody. I'm just here to remind us that the only way that we're going to make change with healthcare or any other issues that we face right now is for us to make that change. Every single one of us. I don't care what you do. I don't care where you come from. You are the change. You are going to be the one to make a difference. And if it's not us, it's not going to change. So we rely on you and you and you, all of us, to make a difference. So that's all I wanted to say. Keep resisting.
And next we have Justin Jefferies of the Homeless Coalition and the editor of Street Vibes.
Thank you. I am here to represent the Greater Cincinnati Homeless Coalition. We believe that healthcare is a human right, just like housing, and We are really outraged to see cuts and attacks on people's right to health care. We see it at the city level. This administration has proposed cuts. We've been working very, very hard to stop having cuts after cuts after cuts. We had cuts to the Health and Human Services Department for about a decade, and it's only been recently that we as a city have been able to restore some of the funding for human services, and we need to do more. We need to do more now, more than ever, because people are suffering. We have a deplorable poverty rate in the city, and as a nation, we have the most adult and child poverty in the industrialized world. We're the only industrialized world on the planet that doesn't have universal health care. We need health care, and we need it now, and we have to organize, and we have to contact our representatives here at City Hall, at the state level, call your Congress representatives, and we're going to let President Trump know that we need universal health care. We need it now. Thank you.
We need health care, not wealth care. The biggest transfer of wealth that we've ever seen, $600 billion, could occur as a result of this bill. Our next speaker is Charlie Wallner of the Faith Community Alliance.
National attention is on Cincinnati to end its poverty issue, and we're closing possibly a health clinic. Cincinnati has an opioid epidemic, and we're talking about closing a health clinic. We're turning the tide on infant mortality, and we're talking about closing a health clinic. I think it's very nice that we talk about, well, I think it's very important that we talk about what's going on in Congress. But politics, a Massachusetts politician once said, is local. And for many of the people, for these health clinics, it's not the last resort, it's the only resort. And if there's nothing that could stand in the way that can connect them to health care, people die. And I think that should be a measure that maybe the press should be considering, is what is the mortality rate or the illness rate that could happen as health clinics close in this city.
All right. Good job, Charlie. And now our next speaker is the president of the North Fairmount community, and as well as on the board of the CCPC, which is the board that governs our Cincinnati Health Department centers. Pamela Adams.
Thank you for all being here. Yes, serving on the CCPC board, we have 12 centers. We have 7 centers. We have 12 school-based health centers. Without our health department, we have been taking cuts for several years, and our budget is only $17.4 million. They want us to take $1.74 million, up 10% of our budget. Now, with this comes in action. What happens to this? We're not going to be able to see the homeless people come to our centers, and we're not going to be able to take care of our seniors and the mothers that go home after they leave the hospital because of this cut coming to us. We are 190 years old. We take care of everyone in this community, regardless if you have health insurance or not. And our dental plan is great. We have a dental center that's down on Elm Street that has putting people's teeth back together that are homeless and give them a new leaf on life. So please, ask the City Council not to take away any more money from the Cincinnati Health Department. We should be on the same platform with the fire department and the city department and police department, which only takes 3%. And I thank you very much. And also contact your congressman and let them know we're not standing for them to do this to us with this health care. We have a lot of people that are disabled that needs the service. We do not want to close down Brexton Cam or any center whatsoever. We would like to extend our hours, but without the money, we are left like we are. Thank you.
Lucy. And our next speaker is Lucy R. Alvarez. She's a community health outreach worker.
Hello, Cincinnati. My name is Lucy R. Alvarez, and I am an activist, a community health worker, and a reporter for Latino media. Although I do not work for the health department, it is my responsibility as a community health worker to advocate for the vulnerable communities that I serve. My job is to ensure that all of my clients have a medical home and access to health care. How can I promote good health in the high-risk communities that I serve without the available services that should be offered by our community? However, I do not blame our city. I know that this is a result of our new government changes. And although our new leader used his values or emphasized his Christian beliefs, calling himself pro-life during the presidential vote, I do not believe that cutting funds from the areas of education, environmental protection, health, and human services is being pro-life. Cutting funds from the following areas to invest in the military and in building a wall is not being pro-life. Threatening our human rights is not being pro-life. Mr. President, the truth is, you are not pro-life. What you are is a bad hombre. Now, Cincinnati, keep fighting for what is right. Because what we are doing today is what is right, and we must stick by our beliefs and stick for our people and work together as one community. As Brian says, as one Cincinnati. Because the people united will never, and I say, will never be defeated. Thank you.
Manuel. Our next speaker is Manuel Perez, social justice activist.
Good afternoon, everyone. My name is Manuel Perez. Thank you, everyone, for being here. In zero cuts, it's very important for us what the health department do for us. And what I notice in my community is when you don't have health insurance, it's hard to have a medical attention. And who provide this is the health centers. And it's the only way for many people, immigrants, in a specific when you're more vulnerable and you don't have a medical secure, it's the only way to have access to health. And this is the reason we're asking our representative zero cut for the budget and health. And also connecting with what happened in national situation, it's very hard to see people think the health is something political, and our health is nothing political. It's we like humans have we need access to the health, and it's very important for us. And we know for the Affordable Health Act, many people have access for first time to have medical attention or medical secure. And it's very important for us. And what we asking them is put attention what we want or what we need to, in thinking the people who is receive benefit for this. And again, zero cuts for our budget and health. Thank you so much.
Our next speaker is none other than Aftab.
Thank you. You guys fired up? Yeah! My name is Aftab Pureval, the Hamilton County Clerk of Courts, and I'm here today to help us protect access to health care, not just for some people, but for all Ohioans. Last week, Representative Steve Shabbat and Brad Wenstrup took coverage away from 80,000 Hamilton County residents. 80,000 people in our own community will lose their health care if the Affordable Care Act is repealed. These are working families who shouldn't have to decide between bankruptcy and taking care of their sick child. Now, did these representatives read the bill before they voted on it? No. Do these representatives know how much this will cost the United States of America? No. They did have time to throw a keg party, though. They did have time to celebrate. We shouldn't be celebrating. We should be standing up for everyday citizens. We should be making coverage more accessible, not less. We should be covering people with pre-existing conditions. Representative Shabbat and Representative Wenstrup are sorely out of touch with Ohioans and with Hamilton County residents, and we will remember in 2018. Thank you. It's my honor to introduce Yvette Simpson.
I want to acknowledge my colleague, Vice Mayor Mann, who, along with me, together we helped restore the Human Services Fund, $1.5 million last year. We stand together in a motion asking the administration not to cut our health department. 0 cuts to health department. You can clap for that. So if passed by our colleagues, we will not see any cuts to health department. Well, why is that important? You've heard all these individuals who I'm so proud to stand with you all, who represent so many people who can't stand here today. I come as one, I stand as 10,000. We come as 100, we stand as 1 million people. We stand as 100 million people across our country who are not just being asked to choose between caring for their child and bankruptcy, but if you're sick, you can't work. If you can't work, you can't afford to live. If your child is sick, they can't go to school. They can't learn. Healthcare is foundational for all of us. The reality is we can't talk about poverty without talking about healthcare. Because the reality is the slippery slope that so many people get caught in is I've got a well-paying job and I get sick one day and I can't take care of myself and now I lose that job. And now I can't pay my rent and now I need a shelter. But that shelter isn't available to me because it's overcrowded. This is just, we know how this story ends. And I'm sick and tired of it. I don't know about you, but I'm tired of us making the same mistakes over and over and over again. We have got to take care of each other, not because it's a good thing or a right thing to do, because it is, but because it's the thing we need to do to make sure our city continues to sustain. We want people to go to work, but we don't give them the tools to be able to work. It doesn't help to have a job training program if I'm too sick to make it to work. It doesn't matter to have a great preschool if my kid's too sick to go there. We have to make sure that we communicate that these things are connected. They're so connected and foundational. It's for people to be able to get up and get out their front door and be able to go to that job, or for that child to be able to get up and go to school and not have to worry about whether they're going to be able to learn that day because they don't have access to health care. It's a shame that we're having this conversation, and I'm done with it. And I got to tell you, the combination of the potential, I'm still calling it potential, come on Senate, the potential repeal of the ACA and cuts the health department, that's catastrophic. Because guess what? It was the ACA reimbursements that was helping our health department get by. That's right. So if you cut them both, it's catastrophic. You can't undo it. We need to be amping up our health department. We need to make sure we have mental health services in each one of our health departments. We need more health clinics throughout our city. Until and unless we close the gap on life expectancy on all parts of our city, until and unless we make sure that our infant mortality rate is 0, until and unless, we should not be having a conversation about cuts to the health department. Vice Mayor Mann.
All right. To start my service to the city, serving with Bobby Stern, a longtime member of council, mayor of the city a couple of years, and her signature issue was to increase health services for the citizens of Cincinnati. And to make sure that human services had a place in our budget. We can't go back on those two pledges, particularly with what's happening at the national level today. So if the budget that comes in on Thursday, that's when it's going to be presented, has a reduction in human services, if it cuts health clinics, health services, for me, it's a non-starter. We have to find another way to balance the budget. Thank you all for being here. Yvette, thank you. And Brian, thank you. Am I forgetting any, I'm not forgetting anyone, right? Okay. So for our final speaker, and I'll just summarize when he's done, but this is Robert Brown. He's the board chair of the CCPC, which is again the governing board of all of the City of Cincinnati health centers. Mr. Robert Brown.
They didn't warn me I had to do this. But nonetheless, on behalf of the Cincinnati Health Department, I would argue strongly that the budget not be cut. The Cincinnati Health Department is the single largest supplier of primary care in the city. We service 43,000 patients. We have a nationally respected and recognized school health program serving 12,000 patients. We have a recently expanded and robust dental program. And largely because of our First Steps program, which is a maternal and infant home health program, we have currently a record low infant mortality. Now, as far as the political environment that we're in this post-factual world with alternative facts, the Ohio General Assembly very quickly requested an assessment of the Medicaid expansion portion of the Affordable Care Act. And the results were surprising. First of all, the primary beneficiaries of the Medicaid expansion portion of the Affordable Care Act were rural white men. The primary benefit was that it saved their lives because their chronic conditions were now managed. There were numerous unintended secondary benefits. Because these guys felt better, they got better jobs, they worked longer, their families became more financially secure, they had access to mental health and substance abuse programs, thereby putting a dent in the opioid epidemic. I mean, it's a no-brainer until you talk to people who want to replace it with a tax cut. I get frustrated by the fact that none of this seems to make any sense. But we cannot cut the Cincinnati Health Department budget. Between 2005 and 2016, we endured budget cuts, but managed to expand our capacity. So now is not the time, especially with the threat of elimination of the Affordable Care Act. Thank you very much.
Thank you so much, Mr. Brown. And I just wanted to say, to put a little number on it, the Obamacare has saved the city $8 million. Should these cuts come forward, and we're doing like a preemptive strike, so to speak, that we don't want any cuts, zero cuts. So even if they say, oh, well, we're not going to cut this, we're not going to cut the health department, we're going to still give a 10% cut somewhere else, we're still staying strong and saying zero cuts. So these budget cuts, if they were to come, are immoral and unconscionable. There are consequences for city policymaking, and a consequence of this decision would be an increase in infant mortality. Our babies could die. It is a known fact that the visiting nurses are an important factor in reducing infant mortality. Our infant mortality rate is already higher than national figures, and we can't afford to lose one more life because of trying to meet a budget. Our babies' lives are more important than any politics. What is the line item cost of one child? What would a parent pay to have their child back? We can't play politics with our babies.
We must support our health department and the vital role it plays in the lives of our citizens. We cannot shut the door in the face of our pregnant mothers and the community of Madisonville. I say zero, you say cuts. Zero, 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 zero. Thank you so much for coming. God bless. Single payer. Single payer. We believe in that too.
I felt like I could have listened to more about what's going